That extra push you sometimes give on the toilet might feel harmless, just a simple way to speed things up when you're busy. But what if I told you that having to push, that strain just to get the urine flowing, is a critical warning sign? What if it's a symptom of a process that could lead to irreversible bladder damage, chronic infections, and even kidney failure? I'm a urologist, a prostate doctor. Every day in my clinic, I see men who've ignored this seemingly innocent habit for years, sometimes for decades. They finally come to see me not when it's a small annoyance, but when it's become a crisis. They come to me when the damage is already done and they're facing serious, life-altering health complications. This habit isn't just a quirk. For many men, it's the first and most obvious sign that a destructive process has started inside their body. It's a silent alarm that, unfortunately, most men are conditioned to ignore. In this video, I want to explain what's really happening inside your body when you have to push to urinate. We'll explore the root cause, which often lies in a tiny gland most men don't think about until it starts causing trouble: the prostate. I'll walk you through the cascade of damage that begins with that simple push, from the bladder to the kidneys, and explain exactly how this habit, if you don't address it, is slowly, quietly, but surely working against you. Most importantly, I'll tell you what you can do, starting today, to understand your body, address the real problem, and protect your health for the long run. This isn't about fear, it's about knowledge and empowerment. So let's get started. The deceptively simple habit: why pushing is a red flag. First, let's be very clear about what we're talking about. When I say straining, I mean having to bear down, using your abdominal muscles to force urine out of your bladder. Healthy urination should be an almost passive event. It's a process of relaxation. When your bladder is full, it signals your brain. You go to the toilet, relax your pelvic floor muscles and the sphincter, and the bladder muscle itself, called the detrusor muscle, gently contracts to expel the urine in a steady, easy stream. There should be little to no effort involved. If you find yourself standing there waiting for the stream to start, or if you have to push to get it going or keep it going, that's a fundamental sign something is wrong. It's like trying to drive a car with the emergency brake on. You can stomp on the gas, make the engine roar, but you're fighting against a force holding you back. That pushing and straining is you stomping on the gas. So, what's the emergency brake? For millions of men, that brake is an obstruction in the urinary path. Your body is telling you there's a blockage. Pushing isn't the solution, it's a symptom of the blockage. Many men normalize this. They think, well, I'm just getting older, things slow down. They adjust, they push a little harder, they accept a weak, intermittent stream as their new normal. But this acceptance is dangerous, because while you're consciously compensating on the outside by pushing, your body is fighting a damaging, silent battle on the inside. This habit of straining is the first step in a dangerous chain reaction. By ignoring the signal and just trying to overpower the problem, you are putting your bladder, your urinary tract, and ultimately your kidneys under immense, unnatural pressure. This pressure doesn't just vanish after you leave the bathroom. It has cumulative, long-term consequences. The habit isn't the problem. It's the blaring alarm bell telling you that the real problem has taken root. And for the vast majority of men experiencing this, that problem can be traced back to one specific place. The root of the problem, the prostate gland. The prostate is a small gland, about the size of a walnut, that sits just below the bladder and surrounds the urethra, the tube that carries urine out of your body. Think of it like a donut, with the urethra being the hole in the middle. In a young man, this gland is small and flexible, and urine flows through without any issue. It's a clear, open channel. However, as men get older, something very common happens. The prostate undergoes a growth phase that continues for most of a man's life. This condition is called benign prostatic hyperplasia, or BPH. The word benign is important. It means this is not cancer, and it doesn't increase your cancer risk. But hyperplasia means growth. As the prostate enlarges, it can start to squeeze the urethra, just like stepping on a garden hose. This squeezing action is what we call bladder outlet obstruction. All of a sudden, the open channel for urine has become narrow and constricted. This is why BPH symptoms start to appear. You might experience hesitancy, that delay before the stream starts. The stream itself might become weak or slow, or it might stop and start. You might feel like you haven't fully emptied your bladder, even after you've just gone. This feeling of incomplete emptying is a classic sign of BPH. Because the bladder isn't emptying properly, you might need to urinate more frequently, both during the day and, most frustratingly, at night, a condition called nocturia. This is where the habit of straining comes from. Your bladder muscle is trying to push urine out, but it's meeting this new resistance from the squeezed urethra. To overcome it, you instinctively recruit your abdominal muscles, you bear down, you push. You're manually increasing the pressure to force urine through that narrowed channel. It might work for a while, but you're forcing a system designed for low pressure to operate under high pressure. And this is where the real damage begins. The problem isn't just the inconvenience, it's the war you're waging on your own body, and the bladder is the first casualty. The bladder under siege, a silent battle. Your bladder is an incredible organ. It's a muscular reservoir, made to stretch as it fills and then contract to push urine out. But it's designed to work against very little resistance. When BPH creates a blockage, the bladder has to work much, much harder. Imagine your bladder's main muscle, the detrusor, as a weightlifter. Normally, it just has to lift a light weight. With BPH, it's now being asked to lift a heavy one every single time you urinate. What happens when a muscle is forced to work against resistance? It gets bigger and stronger. This is called hypertrophy. In the early stages of BPH, the bladder wall actually thickens. It's building muscle to overcome the obstruction. This is why, at first, a man might only notice symptoms like urgency or frequency. The bladder is overactive from all the extra work. But this can't last forever. Like a weightlifter who trains too hard without rest, the muscle eventually starts to fail. The detrusor muscle, after years of straining, starts to lose its strength. It becomes fatigued, weak, and scarred with fibrous tissue, losing its elasticity. This is called decompensation. As the bladder weakens, something else can happen. The intense pressure from straining can cause small pouches, called bladder diverticula, to form in the bladder wall. Think of them like little blowouts on an old tire. These pouches are a problem because they don't empty properly when you urinate. Urine gets trapped in them and becomes stagnant, creating a perfect breeding ground for bacteria and leading to a much higher risk of recurrent urinary tract infections. This whole process, the thickening, weakening, and pocket formation, is often silent. You might not feel it happening. Your only clue is that you still need to push, or maybe your stream is getting even weaker. But inside, your bladder is being fundamentally, and in many cases, irreversibly damaged. Once that muscle is severely damaged, no medication or surgery can fully restore its original function. You're left with a bladder that can't do its job, and that's just the start of the ripple effect. If you're finding this information valuable, and if it's making you think differently about your own health or the health of a man you care about, please take a moment to click the subscribe button. My goal is to provide clear, expert information to help you protect your health, and by subscribing, you won't miss out on future videos. It's a small action that can make a big difference. Now, let's get back to the serious consequences of this process. The ripple effect, when a bladder problem becomes a body problem. The damage doesn't stop at the bladder. The consequences of chronic straining and incomplete bladder emptying spread, creating a cascade of problems. This is how a simple bathroom habit truly begins its slow, destructive journey. Part 1. The constant threat of infection, UTIs. As we've discussed, when the bladder doesn't empty completely, you're left with residual urine. Healthy, flowing urine is one of the body's main defenses against infection because it physically flushes bacteria out. But when urine sits stagnant, it's the perfect environment for bacteria to multiply. This dramatically increases the risk for urinary tract infections, or UTIs. While often thought of as a female health issue, UTIs in men can be very serious, causing burning, pain, and recurrent infections that lead to more inflammation and damage. Part 2. The formation of bladder stones. Stagnant urine causes other problems too. Urine is full of dissolved mineral wastes. When it sits for long periods and becomes concentrated, these minerals can crystallize and clump together, forming hard masses known as bladder stones. These stones can cause more irritation, pain, and bleeding, and can even worsen the blockage. In some cases, a stone can completely block the flow of urine, creating a medical emergency. Part 3. The ultimate danger: kidney damage. This is the most serious, life-threatening consequence of long-term, untreated urinary retention. Your urinary tract is a one-way street. Urine flows from the kidneys, down tubes called ureters, and into the bladder. One-way valves prevent urine from going backward. When the bladder is constantly overfull and under high pressure from straining, this system can fail. The pressure can force urine backward up the ureters into the kidneys. This backward flow is called reflux. This back pressure causes the kidneys to swell, a dangerous condition called hydronephrosis. The kidneys are delicate filters, not high-pressure storage tanks. This constant pressure physically damages their tiny filtering units, and over time, this damage is irreversible. The kidneys lose their ability to filter waste from the blood, which can lead to chronic kidney disease and, in severe cases, complete kidney failure. At that point, a person would need dialysis or a kidney transplant to survive. And it all can start years or even decades earlier with what seems like a harmless habit: pushing to pee. Taking back control, the path to healthy urination. I know that what we've just discussed is alarming. The goal isn't to scare you, but to show you how serious it is to ignore your body's signals. The good news is that this entire cascade of damage is preventable and, in most cases, treatable, especially if caught early. Here's a clear plan to take back control. Step 1. The most important step: see a doctor. If you are straining to urinate, you need to see a healthcare professional, preferably a urologist. Self-diagnosing is not an option. While BPH is the most common cause, other serious conditions can cause similar symptoms, and it's vital to get an accurate diagnosis. A urologist will talk to you about your symptoms, perform an exam, and may run simple urine and blood tests to see exactly what's going on. Step 2. Behavioral changes and lifestyle modifications. For milder symptoms, we often start with simple changes. One technique is double voiding. After you urinate, wait 30 seconds, and then try again without straining. Another is timed urination, where you go on a schedule instead of waiting for an urgent feeling. Reducing bladder irritants like caffeine and alcohol can also help significantly. Step 3. Medical treatments. If lifestyle changes aren't enough, we have excellent medications. Alpha blockers. Drugs like tamsulosin relax the muscles in the prostate and bladder neck, opening up the urethra to make urination easier. They work quickly, often within days. 5-alpha reductase inhibitors, 5-ARIs. Medications like finasteride actually shrink the prostate gland over time by blocking the hormone that fuels its growth. These are best for men with larger prostates and can prevent the problem from getting worse. Step 4. Advanced therapies and minimally invasive procedures. For men who need more than medication, we now have a fantastic array of minimally invasive therapies. These are often outpatient procedures with quick recoveries. Procedures like UroLift use tiny implants to hold the prostate tissue out of the way, while Rezum uses steam to remove excess tissue. For more significant blockages, the gold standard surgery remains the transurethral resection of the prostate, TURP, which removes the obstructing tissue from the inside. The point is, there are so many effective options. You don't have to live with the symptoms or the risks. That extra push you give on the toilet is not a solution. It's a signal. It's your body telling you there's a problem that needs your attention. Ignoring it or trying to power through it is a choice that can lead you down a path of progressive, silent damage to your bladder and kidneys. A weak urine stream isn't a reflection of your strength or your age. It's a reflection of a physical blockage. Addressing that blockage is one of the most important things you can do for your long-term health. You can sleep through the night again. You can leave the house without constantly mapping out every bathroom. You can protect your body from the silent cascade of damage that begins with that simple strain. The first step is always the hardest, but it's also the most important. Talk to your doctor, get evaluated, understand your options. The path to healthy urination and a healthier life is clear, and it starts by acknowledging that warning sign and choosing to act. Thank you for watching. If this video was helpful, please share it with the men in your life, your father, brother, and friends. This is a conversation we need to have more openly. And please, leave a comment below. Have you experienced these symptoms or been worried about them? Sharing your experience can help others feel less alone. Subscribe for more essential health information and take care of yourselves.